All right, thank you, Gustavo, and good afternoon, everybody, or I should actually say good evening, and greetings from Finland, since it's already 8 p.m. here. But anyway, good afternoon, and thank you, Gustavo, for the invitation to an opportunity to talk about dry cow therapy. It's been interest of mine and the topic of my research for quite a while. We already did some projects and studies while I was in Ohio a while ago, and have done also some dry cow therapy studies here in Finland. So my intention is to start this presentation with going over some basic things about mastitis, and then we'll look at the importance of the dry period for udder health. We'll talk about drying off methods and compare abrupt, and talk a little bit about abrupt and gradual cessation of milking. And then we get to the dry cow therapy, and we'll compare and contrast selective and blanket dry cow therapy. And then I'll share you some of the results from the Finnish experience and our studies from here, as Finland is one of the few countries that has practically always used selective approach to dry cow therapy. So with that, the basic thing is that mastitis continues to be the most common and costly disease of dairy cows, and for that very reason, it is also the most common reason for antibiotic use in dairy cows. And as you all know, the disease can manifest itself either in clinical or subclinical form, and it can occur during the lactation as well as during the dry period. So, and for the fact that it is the most common reason for antibiotic usage, that has actually part of the reason why we are looking at the use of antibiotics at dry off and during the dry period. But let's start with the basic. Sometimes I think that it's good to remember the very basic stuff, like even though it is very fundamental, because it is very fundamental. So mastitis refers to the inflammation of the mammary gland. And it's almost always caused by bacteria that get into the udder through the teat canal, and they cause the infection. And in order for the infection to develop, there are actually three basic steps that need to be fulfilled. First, since the bacteria get into the udder through the teat canals, the teat ends need to get exposed to the disease-causing bacteria, and that certainly isn't no problem in the barn environment. There are bacteria all over in the environment. When they are on the teat skin, these bacteria also need to get inside of the mammary gland through the teat canal. And if they manage to do that, then they have to survive the cow's own defense system and be able to grow in the mammary gland to cause some problems in the cow. And probably most of the infections we have no idea that the bacteria got in the udder because the cow was able to fight them off. But looking at dry period, I would argue that it's probably the most critical time in the lactation cycle of the cow, because it prepares the cow for the following lactation and pretty much determines her health, the lactation performance, milk yield, and even the longevity in the herd. So if something goes wrong during the dry period, it can have quite devastating consequences. Typically, we recommend about 45 to 60 day dry period, or also can say 6 to 8 week dry period. And it's been shown that if the dry period is much shorter, or if it's shorter than 30 days, it has impact on the milk production, and the milk production decreases in the subsequent lactation. And that occurs for the fact that because the dry period is sort of the rest period for the udder, and during that time, the secretory tissue or the milk-producing cells in the udder are actually regenerated and renewed, and there are new cells coming up that are producing the milk. And if the dry period is very long, that can have an impact on the future milk production. The other good part, besides the regeneration of the new milk-secreting cells, is the fact that it is a great opportunity for us to treat any existing, typically subclinical intramammary infections that the cow may have at the time when she goes dry. That said, the flip side of that is that there's also a high risk of the cow getting new intramammary infections during the dry period. But one way or the other, we want the cows calving with healthy udders after the dry period. However, the odds are against her in that, because the dry period is extremely challenging time for the cow and her udder. A good portion of the fetal growth actually happens during the very last part of the gestation, which would be coincide with the dry period, about 2 months of the dry period, and that puts a lot of nutritional demands on the cow. Also, the udder obviously undergoes drastic changes when it goes from lactating to dry and then again lactating during this period. And as the cow prepares for the next calving, there are a lot of hormonal and metabolic changes also occurring in her body. So these are natural physiological changes that occur in the cow. But on top of that, we as the caretakers of the cows, we also impose many changes on her. There's location and social group changes as we move the cows from one pen to another, and often there's also feeding changes during this period. So this makes a dry period a very high stress time for the cow, and stress always impacts the immune function and it negatively, and it so as a consequence, the cow may have a lowered immune function. As a consequence of all that is happening during the dry period. So if we look at the phases of different sections of the dry period, we can divide it into three different phases. The first one is about 2 to 3 weeks, which we call active involution, and then involution is the shrinking of the udder, and that is when it's transitioning from the lactating to a dry state. And during that time, there's increased risk for new infections. Then in the middle of the dry period, there's the udder is already fully involuted, it's dry, it's not producing any milk, and at that point, it's very resistant to new infections. And there are actually spontaneous cures of potentially already existing infections at that point, because the natural defense factors are quite high in concentration at that point of the dry period. Then as the calving approaches, the cow starts producing milk again, and the formation of colostrum is ongoing. And then again, the cow is at increased risk of new infections. And this one is actually quite nicely depicted by some British researchers from whom I borrowed this graph. But this red line shows the rate or the risk of new intramammary infections. And you can see that after dry off, there's clearly a peak on these new infections right after. And then in the middle of the dry period, the rate is actually quite low, but it then goes up again as the calving approaches. So the dry period is a high risk time for new intramammary infections. And these infections that occur during the dry period are typically caused by environmental pathogens. And it's been also shown that the clinical mastitis that occur in the early lactation, they are often due to infections that the cow already got and were established during the dry period. So that's the risk of infections during the dry period. And then we take a look at the drying off methods, and we typically talk about two types of dry off. We can talk about abrupt and gradual cessation of milking or dry off. And with abrupt cessation, we mean that the cow is milked a normal way, whether it's 2 times a day or 3 times a day or whatnot. She's milked that way to the very end, to the calculated dry off day, and then she's moved to the dry pen. With the gradual dry off, we actually start reducing the milking frequency and can go to once a day milking for a week or 2 weeks or skip, do it for 5 days and skip 1 day of milking, and there are different protocols, and that depends on the may depend on the farm quite heavily. The abrupt cessation of milking is definitely the most common dry-off in many countries. It's easy to implement. You just milk her normally until the day of dry-off, and then move her to the dry pen. And while every single cow that stays in the herd for longer than one lactation goes through these drying off procedures, it's quite interesting that there's the research on actual drying off methods and their impact on udder health is actually relatively limited. There's not that many studies on that. There are some studies, and they span out on almost over 100 years. There's some first reports are from already from the 30s, and these studies have compared intermittent milking or the gradual dry off with abrupt cessation of milking. And in these studies, the protocols how this was done is quite different. Obviously, the milk yield levels are quite different on the different decades. Some studies have used dry cow therapy, some have not. In some studies, the feed was restricted, in some it was not. But if we look at the results from these studies and try to conclude something, the conclusion is that the cows that were tried off by intermittent milking, by reducing reduced milking frequency, these cows had fewer intramammary infections at calving than did the cows that were tried abruptly. And when thinking about the new intramammary infections overall, the teat end really is the first line of defense. That's where the bacteria get into the udder. And normally, the cells that are lining the teat canal, they produce a substance called keratin, which is kind of a sticky, waxy substance that has some antibacterial properties as well. And during the lactation, when we milk the cows, this keratin is flushed away. But when we stop milking, the keratin accumulates and builds up into the teat canal and forms a block and closes the teat canal. And this closure is a key to avoiding new infections after dry off. And it's been shown that it takes about a week or two before the teat canal closes after dry off. But a study has shown that even at 6 weeks, almost 1/4 of the teats were still open at that point. So it can be quite delayed how those teat canals close. And that is related some way to milk yield, and it's the delayed teat end closure and the delayed formation of keratin plaque has been shown to be associated with high milk yield at dry off and milk leakage and more infections at calving. And when I was still in Ohio, we did some studies on this, and one of the studies told us that for every 12-pound increase in milk yield that went above 27 pounds per day at the time of dry off, the risk of infections at calving increased twofold. So clearly higher risk with higher milk yield as the milk yield went up. We did also a study where we had half of the cows being milked once a day, and the other half was milked normally twice a day. And we compared the infection status of these cows. And while the actual milking frequency didn't seem to be associated with the amount of infections we saw, we noticed that the cows milked once a day, their milk yield went way down. And when we looked at cows that were healthy at dry off, we noticed that the quarters of cows that had milked over 250 pounds during the last week of lactation, now that would be about 36 pounds per day, they had 7 times higher risk of being infected. They were 7 times more likely to be infected at calving than the quarters of cows that had been milking less than 165 pounds during that last week, or about 25 pounds per day. So huge difference, 7 times higher risk with a higher milk yield during the last week of lactation. So with gradual dry off, by reduced milking frequency, we can get the milk yield down before the final milking. It actually speeds up and accelerates the involution or the shrinking of the udder. That we can get the natural protective factors in milk and in the udder go up already before the final milking. That results of this lower milk yield and gradual dry off also results in fewer open teat canals and less milk yield leakage, and then fewer infections. And it also improves the cow comfort, especially with high producing cows. Before the milk production actually stops, it takes several days before the milk keeps on accumulating there after the final milking and causes a lot of pressure in the udder, which can be quite painful and discomforting for the cow. So with the gradual gradual dry off, we can also improve the cow comfort. While this is such an important topic in my mind, there are actually no studies that have been designed to specifically determine the optimal milk yield at dry off. But if I look at the studies that we did, if we can get the milk yield below 30 pounds at the time of my final milking, that seems to be quite good level already. Might be hard to achieve, but with a gradual dry off, it's possible to get there. So in summary from this part, we can say that the cows are highly susceptible to new infections in the beginning and at the end of the dry period. And most infections that occur during the dry period are environmental, and they occur in quarters that have open teat canals. And high milk yield at dry off is associated with milk leakage, open teat canals, and more infections and calving. So getting the milk yield down with a reduced milking frequency and or feeding changes and restricting the energy intake before the final milking have been shown to have a beneficial effect on udder health as well as cow comfort. And then we can move over to the dry cow therapy and use of antibiotics at dry offs. As you all are aware of what we are talking about when we talk about dry cow therapy, it's the administration of long-active antibiotics into the mammary quarters at the end of lactation. And this was already developed way over 60 years, and the very early studies on dry cow therapy showed that and demonstrated that it is a very effective tool to improve udder health and to eliminate existing infections. And due to those very promising results, it was recommended very widely, and indeed, dry cow therapy is an important part of most mastitis control programs at the moment. But the approach to dry cow therapy or DCT actually differs mostly between countries. The countries have very different approaches to this. So the two common approaches is blanket dry cow therapy, where all quarters of all cows are treated routinely at dry off. Regardless of whether they are infected or not, they get the antibiotics. And the other approach is selective dry cow therapy, where we selectively treat only those cows that are infected or infected cows or quarters, and those get the antibiotics. Or it's the cows or quarters that we suspect to be infected. We may not know that there is really actually a bacteria, but we suspect that they are infected based on the somatic cell count. And with the dry cow therapy, our goals and aims is to eliminate any existing subclinical infections and also to prevent new infections from occurring. So the main difference between these two approaches and between blanket and selective DCT is the treatment of healthy cows with antibiotics. And currently, over the past decade or past couple of decades, this blanket approach has become under scrutiny, and it's increasingly considered unacceptable because we have increasing concerns about antimicrobial resistance and the ability of bacteria avoiding the effects of antibiotics. There's some social pressure also towards more prudent use of antibiotics, and in Europe there's actually been legislative changes so that the EU regulations on veterinary medicinal products currently prohibits prophylactic use of antibiotics, and that is directly related to dry cow therapy. So the producers in Europe have been forced to move away from blanket dry cow therapy. It's prohibited by the EU regulation at the moment. In countries where blanket dry cow therapy has been used widely, the very widely held belief has been that if you switch from treating all cows to only treating certain cows selectively, that it would be detrimental to udder health and therefore it would not be economically justified. And also one argument against blanket dry cow therapy has been the fact that it's very challenging to accurately and cost effectively identify the cows that would need the DCT and those that do not need the antibiotics at dry off. But really the antimicrobial resistance has been the driving force into a lot of us trying to figure out whether we can make the selective dry cow therapy work and move away from blanket use. So with that concerns about the antimicrobial resistance during the past decades, there's been numerous studies. It's really a hot topic of research among mastitis researchers. So there's numerous studies on selective dry cow therapy done in different countries, and these studies are trying to. There are three things that they are mainly being trying to look at them. One is the try to evaluate the criteria that can be used for identifying the cows that would need the treatment and those that do not need the treatment. And test-day somatic cell count is one of the most common criteria used, as well as the mastitis history of the cow. And then other way of looking at it, detecting the infections is obviously the bacteriological diagnosis of the infections, and that requires bacteriological culture of the milk. In some studies, some studies have used on-farm culture, and some studies culture in the lab, and also PCR is a methodology to do the bacteriological tests on milk, and that detects on its polymerase chain reaction, and it detects pieces of the bacteria or the DNA of the bacteria, genetic material of bacteria, to identify whether there's any pathogens in milk. These studies are also looking at the impact of selective dry cow therapy on udder health and the economic consequences of dry cow selective treatment of cows at dry off. So if I were to very quickly summarize what these studies actually show, there has been some controversial results on this, especially the earlier studies that looked at selective dry cow therapy. For example, one that we did in Ohio, some of them have reported that the untreated cows actually had higher somatic cell count after the calving, and some studies have reported that there are more clinical mastitis after calving in the cows that did not get antibiotics. But those studies were mostly done without any internal teat sealants. But when the studies have also included the use of internal teat sealants, there's really have been no difference in the udder health and milk production of the cow. So indeed, selective dry cow therapy can maintain udder health and milk production. Obviously, there's been some differences between the studies, and there's always herd-to-herd variability because all herds are different. But also, several studies have shown that economics is not an argument used against selective dry cow therapy, and this holds true especially in herds where already have pretty good udder health, and the bulk tank somatic cell counts are relatively low, so which indicates that there's not a whole lot of subclinical infections. So it's not economics that would keep you away from switching to selective Trigal therapy. So the one main thing what all the studies are showing is that if you go away from blanket treatment to selective treatment, that significantly reduces and it can reduce the antimicrobial usage in the dairy herds. And that's obviously what we aim at with the selective treatment, to get less antibiotic usage. So we did several studies on dry cows when I was in Ohio, and I knew that in Finland we actually producers use quite little dry cow therapy, but there was no numbers and no actual data collected on that. So we did an online questionnaire, sent an online questionnaire to all Finnish dairy herds that belong to DHI. In 2017, that was soon after I had come back to Finland, and our goal was to estimate the use of antimicrobial DCT in Finland. We got response from over 700 producers, and majority of these farms actually reported using selective dry cow therapy. About 78% said that they treat cows selectively. 13% said that they treat all cows, and 9% said that they don't use antibiotics at all in their herd at dry off. And they were able to make comments on the questionnaire. And for example, this 9% that didn't use any DCT, they just reported that they felt that the udder health was so good that there's no need for antibiotics at dry off. And these producers reported using test day somatic cell count and the mastitis history as the criteria to decide which cows are to be treated. And in addition to these criteria, 87% of the responders said that they tested milk samples microbiologically from at least some cows before they did the dry-off to know what bacteria are there. And even what was quite surprising and interesting to me, having been in the US for almost 20 years at that point when I came back, even in the blanket DCT herds, almost 2/3 of them reported to test milk bacteriologically, at least from some cows before they gave the Trigal therapy to the cows. And most of these blanket DCT herds had used that approach less than 5 years, only a couple of years maybe, whereas the selective herds had practically always used that approach. We also asked the producers about the use of internal teat sealants, and about 1/3 said that they use them. And almost all farms, 96% of the farms, dried cows off gradually by reducing milking frequency, and also 87% said that they changed the ration to restrict the energy intake of the cows before dry off. From the same study, we have the DHI data from these herds, and we compared the milk yield and the udder health from there, and we found no differences in herd level somatic cell counts or milk yield between herds that used blanket treatment, selective treatment, or no treatment at all. On average, in Finland, about based on this study, 21% of the cows were treated with dry cow therapy. However, what we saw on this study is that the cows in the selective DCT herds, the treated cows had lower somatic cell count at calving than untreated cows. And it's probably due to the fact that if you miss giving the the Trigal tubes on to high somatic cell count cows at dry off, it does have a negative impact on the subsequent lactation somatic cell counts and milk yield. And that sort of seemed to be case here too. We also did a clinical trial looking at what how the cows are doing in the Finnish herds, and we wanted to evaluate cure rates and new infection rates and post-calving intramammary infection risk among the cows that received or did not receive dry cow therapy. There was 12 automatic milking system herds enrolled in the study, and all of these were using selective dry cow therapy, and none of them used internal teat sealants. We divided cows into 3 study groups based on the last test day somatic cell counts. Cows that had somatic cell count between 100 and 250,000 cells, they were randomly assigned to 2 groups based on the cow's ear tag, so that half of them got DCT and the other half did not get DCT. And then if the cow had somatic cell counts over 250,000 cells, they all got treated. And the cows that were had somatic cell counts below 100,000, we didn't include them because we consider them to be healthy, and the farmers would not have given antibiotics to them anyway. So we collected quarter milk samples from these cows and did a PCR testing on those, and we collected those as within 0 to 1 day before drying off, and then on the day of calving, and within four days of calving, we collected milk sample and tested them bacteriologically. And very quickly on the observations from this clinical study, cure risk was very high in all of the groups, even among the cows that did not get antibiotics. It was, however, in that group, it was the lowest cure rate was in that group, but it was still 83%. So the spontaneous cure is quite high during the dry period. The untreated quarters were more likely to acquire a new infection during the dry period compared to treated ones. And again, like I said, no teat sealants were used in this study. Even though, and the non-aureus staphylococci or Quercus negative staphylococci were the most common cause of intramammary infections after calving and also at dry off. And just to show that we do actually, even though most farms use selective dry cow therapy, we actually have a very good quality milk overall. This shows the somatic cell counts in Finland from 2018 to 2023, and it's been very steady from year to year. The different blue colored bars here are the different years, and here's the month. Sorry, that's in Finnish, but it goes from January to December, and it's quite steady. And in 2023, the average somatic cell count was about 136,000 cells in the Finnish herds. That is all the milk that goes for milk processing in Finland. So the question is that I know that the blanket dry cow therapy is still the mainstream or the most common approach in the US, but considering that would the DCT work on your farm? So some of the criteria that are worth considering is that probably average bulk tank somatic cell count should be below 250,000 cells per mil. That indicates the how much subclinical infections there are, and having it low enough indicates that. We need good record keeping on clinical mastitis cases and regular cow level testing of somatic cell counts, and that can be for example, we do the DHI tests and test days. And you should have a knowledge which bacteria are mostly causing the mastitis in the herd. The contagious pathogens should not be a big problem in the herd. So Staph aureus prevalence should be relatively low, and there should be no Akamachi. And these are the pathogens that typically are spread from cow to cow during the milking. So we want these contagious pathogens to be very low in the herd or non-existent, especially with strep ag. And good hygiene during the drying off procedure is a requirement for success successful implementation. So which cows should be treated at dry off? And as I already said, there are different criteria that can be used. And the most commonly we use the somatic cell count is used, and that's easy. If you are on DHI, you get the test day somatic cell counts. CMT can be used, clinical mastitis history, and then obviously the bacteriologic diagnosis tells about the causal bacteria in the milk that causes the infections. The cutoff of 200,000 cells is commonly used. It can be looked at from the last test day or from 1 to 3 test days before the dry-off, or you can look throughout the whole entire lactation. And the lower the somatic cell count cutoff is, the more cows will be treated. Some of them might be treated unnecessarily. There might not be any infection, but few are left without treatment. So if you're sort of hesitating that do you dare to try it, putting the cutoff relatively low is a good way to start when moving away from the blanket treatment of all cows. But it is good to remember that no test or none of these criteria are perfect, and there likely will be some false negatives and false positive results, such that some infected cows may be left without treatment and some non-infected cows may get the treatment. So, but overall, these do work relatively well and can be relied on. So high somatic cell counts are those that have subclinical infections, and if the somatic cell count is over 200,000 cells per ml several times during lactation or at the end of lactation, those are candidate for dry cow therapy. And then you can also use the CMT results, and if you get a positive result, then that might be a candidate for DCT. Also, cows that have had clinical mastitis during lactation, and if she was treated but the somatic cell counts are still high, those cows should also get treatment at dry off. And then a word about internal teat sealants. They are recommended especially for cows that are not getting the antibiotic dry cow therapy. As we talked earlier, the keratin plaque and the closure of the teat canal is crucial for prevention of infections and the bacteria getting into the mammary gland at the time of dry off. And these internal teat sealants actually mimic this keratin plaque, and they physically closes the teat canal. And these have been shown to be very effective in preventing new infections during the dry period. However, I have to emphasize that the excellent hygiene is required when you apply them to the quarters, so that you don't accidentally enter any bacteria with the teat sealant when you are inserting them, because remember there's no antibiotics taking care of the bacteria then. So if there are some challenges over a dry period, or if there are a lot of infections right after calving, that may be related to challenges during the dry period, and at that point, when you see a lot of cases right after calving, it's worth to check the DCT usage and DCT protocols. And make sure that the drugs that you're using, they are actually effective against the pathogens that you have in the herd. It's probably a good thing to cull chronically infected cows if that's just possible, because chronically infected cows, they are usually not that easy to cure, even with dry cow therapy. Check the environment, bedding, and cleanliness of the cow and udders and teat end conditions. And if there are a lot of infections after calving, check when you're checking the dry off procedures. Try to see what is the milk yield level at dry off. Could that and are the cows leaking milk after dry off? Then the final milking, there might be a maybe solution found from there. And good record keeping is essential. If there's a saying that if you can't measure it, you can't manage it. And if you don't keep records, you don't know if it's actually working in your herd. So it's important to keep records on all the treatments so that you can actually then see yourself what is going and what is the direction that the herd is headed towards with the selective treatments. So to wrap up, for prevention of intramammary infections after dry off, thinking about the three steps that we were talking about, minimize the T10 exposure and challenge from the pathogens in the environments. And so that's a clean environment and then reducing the milk yield prior to the final milking to enhance the teat canal closure so that the bacteria cannot get into the udder. And then try to maximize the cow's own defenses. They can very often fend off the bacteria there just with their own immunity. But that means that the cow comfort should be good, proper nutrition, and avoid stressors, no overcrowding, and minimize the number of group changes as much as possible. And so simply easier said than done, but kind of keep the cows clean, dry, and comfortable to maximize their defense systems. And for future perspectives on this topic, I think that the dry cow therapy will continue to be an important part of mastitis control, but the use of antimicrobial DCT should be more targeted, and we should know which cows we treat and why. But the question remains that what is the best way to identify the quarters or cows for treatment? And there's with blanket dry cow therapy, it was easy because the advice was the same for each herd: treat every cow with every quarter of every cow. But with the selective dry cow therapy, the procedures and advice in general probably need to be herd specific and customized for each herd that see what works best. And the milk yield at dry off, I believe that continues to challenge us because cows are producing more and more over the time, and we should get the milk yield down enough before we try the cows off. So overall, good management, clean, dry, and comfortable environment, and balanced nutrition are crucial in keeping the cows healthy during the dry period. And with that one, I don't know. I think that I'm hopefully pretty much on time, but I would like to thank you for your attention. And if there are any questions or comments, I will do my best to answer them.